Okay, all right, great. Well, Happy New Year and welcome everyone. Thank you so much for joining Autism Speaks as we present part two of our Navigating a New Autism Diagnosis series. We hope that when you register for this webinar, that you also register for part three, which will take place in 2 weeks on January 27th at the same time. Thank you all so much again. My name is Janet Williams, and I am Outreach Director for Autism Speaks. I'm also joined by Marianne Sullivan, who's our Autism Outreach Director, and Colleen Shan. They will be assisting on tonight. So thank you, thank you, thank you. It's important that you understand that Marianne and I both, we are parents of sons who are also on the spectrum, and we just so excited to be sharing this wonderful information with you on tonight. We also understand that autism affects the way a person in which they may perceive the world, and it may make communication and social interactions difficult, or they may have a tendency to engage in repetitive behaviors. We know that their symptoms and their severities of the symptoms may vary widely across these three core areas, but if taken together, it may result in relatively mild challenges for some people on the spectrum. Now, for others, it may be even more severe, when those repetitive behaviors or lack of spoken language interfere with their everyday life. So, early intervention and access, which is what we'll be talking about tonight, is so vital. And to make sure you have access to those reliable services, it is imperative. So, hang tight. And for now, I am going to turn it over to the wonderful Marianne Sullivan, who will share Autism Speaks mission statement and some additional information about tonight's program. So thank you, Marianne.
You're welcome. Good evening, everyone. I'm glad that people have made it. I apologize for us canceling last week, but we're here this week. And as Dr. Corey just mentioned, I'm glad that we're going to be able to do this tonight because the information that we're presenting is very, very important. Even though my son is 28 years old today, I can remember the day and the few weeks afterwards when he was diagnosed at the age of 3. How important that time is, how important the connection is, and also as a parent to understand how to advocate for my son. So that's why I'm here today. I'm really excited about bringing this information to you. I think it's very important for us to talk about the mission statement of Autism Speaks. Autism Speaks is enhancing lives today and accelerating a spectrum of solutions for tomorrow. This is very, very important to us. We are focused on our mission delivery. The way in which we look at our mission delivery is through our 5 objectives: increasing global understanding and acceptance of people with autism, being a catalyst for research breakthroughs, and tonight, of course, we're talking about that mission objectives: increasing early childhood screening and timely intervention. And of course, after that, for when kids grow up, is improving the transition to adulthood. And then, of course, last but not least, ensuring reliable information throughout the lifespan for people with autism. So we are also very committed to diversity and equity and access and inclusion. They are also a very, very much an important part of our organization's culture at Autism Speaks. That is led by our CEO, Angela Geiger, our national board, as well as our senior leadership team. We strive to produce a sense of belonging for our staff and for many diverse constituents in which we serve. So thank you again for being here tonight. I will now share a few housekeeping items. We will be recording the session, the program. And we will be sending out a follow-up email with slides, as well as the recording, as well as all the wonderful resources that we have for you. So tonight, you can sit back, relax, listen to the speakers, and know that you'll have those resources in your email, hopefully by tomorrow afternoon. And you can go ahead and view the recording again, if you like. We also will have Q&A session at the end after our speakers present. We may be short on time. If we are, you can please enter your questions into the Q&A box, and then we can save those questions and have someone reach out to you that is part of our autism response team. So your questions will be answered inevitably, hopefully within the week. I think the other thing that I want to mention that I think most people know about is when you are asking questions, you could keep your questions to broad questions about the subject. If it's early intervention, or if it's particular specific intervention that you want to know more about, or an insurance question. The autism response team is really better equipped to handle more personal questions about your family member, yourself, or whomever, and we want to make sure we offer you those privacy issues. So without further ado, I'm going to turn it back over to Janet. Thank you.
Thank you so much, Mary Ann. And for those of you who have received or in the process of seeking an autism diagnosis, either for yourself, or for your loved ones, there are things that you need to know as it relates to insurance, as it relates to waivers, in state-specific and federal guidelines. And so our own Judith Yersurdi, who is our Director of State Government Affairs and from our Advocacy Department, she's going to open up and share some information on how to access those services through health insurance and education. And so, Judith, I would now turn it over to you to share some of this important information.
Thank you so much, Janet. Can everyone hear me okay?
Yes.
All right. Good evening, everybody. And I will just say briefly that I so remember when my son Jack was diagnosed with autism. I took him to the pediatrician on his 2nd birthday just for his 2-year checkup. And our pediatrician at the time did a routine developmental screening, and she asked a lot of questions. If Jack had 2-word phrases, if he could point, if he waved goodbye. And each time she went down the list of the question, I answered no. And every time I answered no, I felt my heart kind of creep up, into my throat a little bit, thinking, oh my goodness, I think something's going on. And she sat down on her little wheelie chair and wheeled over and said to me, she said, something's going on. And within a couple of weeks, Jack had been diagnosed with autism, and I was lost in a world of acronyms and funding sources and the need for therapy. I wanted to make sure he could get all the help that he could get. So I started on that journey. So tonight I want to share with you a little bit of information about how to access services. So if we could go to the next slide. There's some main themes that you need to think about if you have a child who's just been diagnosed with autism. You're going to get services from different buckets. If you need services, you'll get services that are prescribed by your doctor through the healthcare system. You'll also get special education services. So we're going to talk about both of those things just to make sure you're familiar with the basics. So let's move forward to the next slide. All right, so let's talk about healthcare. Healthcare, I never knew how complicated it was until I started wading into the world of healthcare, trying to access services for my son. So you have to ask yourself some questions when you're thinking about your healthcare and access to health insurance. You need to think about what kind of insurance you have. Is it private? Is it through your employer? Or did you purchase it on the marketplace? That's private. Or is it funded through Medicaid? And many people have access to private health insurance, and many people access Medicaid. So we're going to talk about both of those things tonight and what they mean. So next slide. Okay, this is where it gets very wonky. And if you feel confused, please don't worry. As Mary Ann and Janet have both said, we're going to share this information after the webinar, and you can always email our autism response team if you have specific follow-up questions. So I beg you, please don't feel overwhelmed. It's important to know that health insurance laws affect what your health insurance looks like. And some of those health insurance plans, the laws that apply to them are federal. Some plans are regulated by state laws, and it depends on what state you live in or what state your employer's in. And if you're not sure, like if you're like, I don't know if my health insurance, my private health insurance is federally or state regulated, all you need to do is call or email your human resources department at your employer and just ask them. They can tell you very quickly. It's an important thing to know because it's going to affect what laws apply to your private health insurance plan. Next slide. The good news is if you have a state-regulated health plan, one where the state laws apply to your private health insurance, we have over the past 10 years been working at Autism Speaks to make sure that private health insurance laws in the states require coverage of evidence-based autism treatments. And so when my son Jack was diagnosed back in 2006, 2005, Texas, the state where I lived, did not have coverage for any kind of autism treatment. In fact, the minute Jack got an autism diagnosis, his speech, occupational therapy, physical therapy all started being declined because he had autism. So fortunately, Autism Speaks has been working to address this across the country. We passed a law in Texas in 2007 that required health insurance to cover evidence-based autism treatments. And now fast forward to 2021 and all 50 states have passed a law. Texas was state number 3 to do so back in 2007, and now we're at all 50. So we've made some progress, more to do. Let's go to the next slide. Okay, so what's covered in those bills? A lot of times people will say, oh, I think those state laws only apply to applied behavior analysis, and that is an important intervention for many people on the autism spectrum. But please know, the state laws include screening and diagnosis. It includes things like speech, occupational, physical therapies, psychiatric and psychological care, and as I mentioned, I'll say it again, behavioral health treatments, including things like applied behavior analysis. Autism Speaks has on our website a list of all the states, and you can click through on the link to see exactly what's covered and if there are any limits in your state. So if you have a state-regulated plan, that's really important information for you. Okay, let's go back to that colorful map there. What if you have Medicaid and you have a child with autism? So back in 2014, the federal Medicaid agency said, hey, Medicaid, there's all these private health insurance laws in the states, and we have a statute in Medicaid that requires coverage for childhood health conditions. And we think autism is a childhood health condition. And so autism services should be covered. So Medicaid federally told all the states, your kid's on Medicaid, and by children, they mean people under the age of 21, they have to have coverage for screening, diagnosis, and treatment. So those treatments that I mentioned before, screening, diagnosis, applied behavior analysis, speech, OT, PT, Medicaid's required to cover it for children under the age of 21. This map shows that some states are doing a better job than others, and we're working very hard on that at Autism Speaks. The blue states, as far as we know, have fully implemented the Medicaid coverage. Yellow, there's some work that needs to be done. And then Texas, Illinois, and New York are dragging their feet, but we have been working very hard, and we're getting closer and closer in those states. And we know right now during the time of COVID, it's so important for the Medicaid enrolled children to have access to these services as well. Next slide. Too much to cover. I need to be quick though, we have a lot to get through. So we talked about healthcare and services that your doctor might prescribe for your child. You also are entitled at age 3 to a free and appropriate public education if your child has a disability, according to a law called the Individuals with Disabilities Education Act, IDEA. And so it's very important that either through early intervention you are referred, or you can go to your local school district too, and you can get an evaluation and work towards getting meaningful special education services. And just because you get health insurance coverage does not mean you should not also get special education services. Healthcare is meant to help with the symptoms of autism that might be problematic. Education is to help your child access the curriculum. Next slide. We have an amazing tool on the Autism Speaks website that kind of walks you through the basics of how to deal with special education, how to navigate an IEP, an individualized education plan. I know all these acronyms are absolutely ridiculous, so it's really good to have guides like this, and I encourage you to take a look at this to see how you can best approach this. Sometimes you work with IEP teams in your school districts that are helpful. Other times it can be hugely problematic. So it's really important to know the basics so that you can advocate for what your child is entitled to, no matter where you live. Next slide. One really important thing that you should keep in mind is that there are other services that you can get through Medicaid that are not healthcare related, but they're sort of in the other category. So there are things like in-home respite services, home and community-based services. And the big secret that you might not know if you're new to a diagnosis is frequently there are really long wait lists to get these services, and they can really make a difference. For example, in Texas, there are waiver services that can help people who have autism, but the wait list is 15 years long. So it's super, super, super important that you not disregard this, but that you contact your state Medicaid agency. There's a link in this presentation so you can find your state Medicaid agency and get on the wait list right now. Put it on your to-do list. It's so important. There's no downside to it. Get on any Medicaid home and community-based service wait list as soon as you can. It's very, very, very important. So huge takeaway there. Next slide. And that is all from me. I apologize for rushing, but we've got a lot of really important information I want to get to. So I'm going to throw it back to our host.
All right. Well, thank you so much, Judith, for sharing all of that important information. We really do appreciate that, and I'm sure our families will be helped by that information. We have two more guests that's going to be sharing with us tonight. First of all, we're going to have Dr. Jennifer Sykes, and then we're going to go to Dr. Dan Curry. But Dr. Sykes is our next guest, and she's a psychologist at the Thompson Autism Center in Missouri. She understands the importance of equity and access within the healthcare system and is interested in sharing and would like to share information on how medical providers can best support the needs of Black, Brown, and underserved patients to help empower families so that they can have their best experiences. At Autism Speaks, one of our mission objectives is ensuring access to reliable information and services throughout the lifespan, and that includes all people with autism. So at this time, I would like to welcome Dr. Sykes. Thank you, Dr. Sykes.
Thank you. I'm really excited to be here with you guys. But again, I know we have a lot to talk about and I want to leave plenty of time for questions. So I also might go a little bit quicker, but for sure, type any questions you have in the chat or the question and answer box, and hopefully we have some time to get them answered at the end. So like Janet was saying, my name is Dr. Sykes. I am a pediatric psychologist at the Thompson Center for Autism and Neurodevelopmental Disorders. So my job primarily is to spend my days diagnosing autism. So I meet with families and children. We are a pediatric system, so we only see people probably up until about age 21. But I want to talk to you a little bit about specifically some of our families that we don't see as much. So we can go to the next slide. Oh, sorry, no. This is the right slide. I wasn't paying attention. So I always like to start with why are we highlighting certain families? Because I think that, we know that this is a giant national issue that impacts lots of different families. And so sometimes it can feel strange to really target and highlight certain families and talk about things that are specific to them. One of the reasons why we do this, though, is we know that our demographic characteristics, so our race, our gender, our age, our physical ability status, our religion, our education, all of that impacts our experiences. And so for some of our families, that can introduce extra barriers to reaching the services that they need. So for example, we see here on this slide, and again, this is specific to race, but we know that based on your race, there are some differences in even your ability to get an autism diagnosis. So these research studies that I'm highlighting here are really specific to Black, Indigenous, and other children of color. But we know that they're less likely to be diagnosed with autism overall. They're more likely to be misdiagnosed. So we have parents who are reaching out for services and support, and they're being given incorrect conceptualizations of their children, or their children's concerns are being explained in different ways initially. So it's kind of delaying them finally getting that answer that they've been looking for. And then we also know that they're specific to Black children being diagnosed, they're often more likely to have a lower IQ. And the thought process behind that is those tend to be some of our kids whose symptoms are the most apparent. And so there's a concern that when the symptoms are milder, people are missing them or they're misconceptualizing them and labeling them in other ways. So next slide, please. And so again, this not only impacts your ability to get an autism diagnosis, but once you have that diagnosis, we see that it's also impacting people's services. So again, these slides are specific to race, but we also see similar breakdowns kind of based on parent education at times, family SES, and financial resources. Those kind of things can also really open up different doors for you, or unfortunately insert different barriers for you. So in general, families of color tend to have less access to services. So we see less enrollment in early intervention, less enrollment in some of those school-based services that Judith was talking about. So not being advised to seek out some of those services, and then when we are seeking them out, not necessarily being enrolled or being offered the same service menu. We also know that some issues might be more specific to different cultures. So again, this can be culture in general. So we have a lot of rural families that come here. The barriers that a rural family might face can be very different than a family that lives in the center of a city. Their kid might not even have as much access to peers, or there might not be as many resources in their town, or it's a really small town and everyone knows each other and people have really interesting ideas about autism. These are different barriers that people are facing based on their culture. And so sometimes you need programming that recognizes that can help you navigate the things that are specific to your family's challenges. And unfortunately, there just aren't as many of those services. So you can maybe, if you're lucky, you're in an area where you can find services for a kid with autism, but can you find services for a kid with autism whose family doesn't speak English, or for a kid with autism whose family is living in extreme poverty and having lots of challenges connected to that? These are sometimes some of the extra ways our families need to be supported that aren't always available. And we also just know from the healthcare field in general, there are a variety of kind of systemic issues that impact care. So where are providers located? How long do people have to wait? Sometimes that varies based on a variety of factors and a variety of like historical issues. So I know someone in one of the chat boxes talked about, like, for one of the services that Judith mentioned, there was an 8-year wait list in their area. I'm sure there's other places where that wait list is weeks or months, or barely existent. And so those are some of the issues that our families are facing, and we have to think about that and keep all of that in mind. So next slide. So then we talk about a lot of challenges, but we also want to really focus on, like, what can we do about this? I think Dr. Corey is going to talk a little bit more about just the importance of early intervention and some of the ways that can be really helpful. So we know that it's really important, and we know that we want to reduce barriers as much as possible and help families really access this. So next slide. So this is a pretty big topic. I mean, there's a lot that we could say about this one topic. But again, just kind of giving people a quick overview. I know that getting a new diagnosis, you hear so much so fast. And so sometimes it's almost like, let's just tackle on lots of things, and you can come back to those things when you have some time and some space to really dig down deep into specific topics. And so we know that some service providers are signing up for these trainings as well. And so we wanted to really take some time to talk to you guys. Obviously, we talked about this. These issues can come from big places. And so you're not necessarily going to have the power to change every single thing that is leading to these concerns. But there are some things that you can do within yourself and within your agency that hopefully would cut through some of these barriers. So the first thing that we really, so go back one more. Yep. So the first thing that go back one more. There we go, service providers. So really you want to make sure to check your biases. And so just really quickly, for those of you who aren't familiar, implicit biases are those things that we don't even think about, kind of those automatic processes. And so we're not always even cognizant of them. So if we saw someone crossing the street, do we have a knee-jerk reaction in assuming whether or not we're safe or not, whether or not they're up to no good? Like sometimes we just automatically classify people and experiences, and we don't necessarily even have that conscious thought. And so those are the things that we really want to be mindful of, especially as a provider, because that's part of what contributes to kids being misdiagnosed and miscategorized. Some of the other research shows that even once kids of color make it into some of those service streams, sometimes the services they're offered really vary. So kids of color are more likely to be offered like behavioral services. So people are quicker to notice any behavioral challenges or difficulties they might have. And they're less likely to be offered some other services that might just be addressing some of the core autism symptoms that could be leading to some negative behaviors. And so definitely thinking through and being mindful of examining your practices and paying attention to, like, are you routinely, or are there patterns to who you offer what service to, or how you think about specific people or families? We also want to just know the boundaries of your competency. And so I think there have been a lot of great programs coming up to help train more people to recognize autism and to help funnel families into these pathways that Judith was talking about. So referring families for early intervention, referring them for school-based services. What I see sometimes, though, is the opposite, where people are really quick to very passionately tell a family that it is or is not autism, and not always be correct. And so I've had families who have sat on their concerns for years because a provider very confidently told them it wasn't autism. And I've had families who someone told them your kid definitely has autism, and they're very strongly feeling like that's what's going on with their kid when maybe it's not. And so we're doing families a disservice if we don't stay mindful to, it's great that we're enrolling in trainings and being aware of autism and trying to help bridge some of those gaps and reduce some of those wait lists. But autism, we know, is a giant spectrum. There's parts of that spectrum that are really more easily to recognize and easy to train on recognizing. And then there's parts that are more subtle. And so if you're approaching that area where it's like, oh, well, I think, but I'm not quite sure, definitely reach out. There's lots of centers in the area or in the country where you can really help get families to people who would really be able to pull it apart. You also want to be signaling safety to families who might not think your space is designed for them. So I feel like a lot of times spaces in our country really focus on kind of middle class, middle, decently educated, often white families. And so people who don't fit into any of those categories might not feel as comfortable in a space. They might not think that you respect them, or you don't take their concerns seriously, or they just might not feel physically safe in a space. And so I think, being really mindful of that and figuring out ways that you can communicate to other people, like, we know that your lived experience impacts your willingness to seek services, how you're going to respond to services, and we want to be able to have those conversations with you and build a place that works for you. Examine your processes. So how are people getting into your services? Thinking about barriers that might introduce if you're having a lot of written paperwork or language that doesn't fit some of your families, you might be excluding people from your services. You always want to ask and build relationships with the families that you serve, but don't make them responsible for your education and growth. So there's a lot of resources at this point for learning about different cultures and different cultural dynamics. And so you want to take that learning mentality and seek those relationships out and seek those resources out as well. Okay, next slide. So for caregivers, I think it's also really important for me to always help caregivers know their role and their power in the situation. So I know you got a new diagnosis of autism, like Judith was saying, there's a lot that hits you all at once. Not only do you have to go through your own process of really thinking about what this means for your child and your family, maybe negotiating what other people think thinks it means for your child and your family. But there's also so many terms and worlds and different pathways to think about. But above all else, just putting on that advocate hat and recognizing that you do have some power in this situation, and you should be asking the questions and building the relationship and making people slow down and explain things to you. If you don't get it, if you don't know what they're talking about, or if you don't feel like they understand what you're saying, stop and pause. Because as a provider, that is my job. I should be able to explain things to you in a way that makes sense to you. I should be able to help you understand what I'm talking about, dig for the information that I need from you. So even if you're using a term that isn't a clinical term, like, you shouldn't be using a clinical term. You're a parent, I'm the clinician, let's work together. And so if you feel like, no, I think you're misunderstanding what I'm saying when I tell you that X, Y, and Z is happening or is a concern, feel empowered to pause and let people know, hey, I'm not getting it, or you're not getting me. Also recognize that every provider is an individual. I feel like sometimes parents, if you have a negative experience with a provider, that might taint your whole view for the field. And so recognizing that each provider is an individual, and maybe that provider just wasn't a good fit for you, but it's not that all of ABA is bad for you or all of speech language pathology is bad for you. It's that we need to just find a better fit. Again, that can be challenging in some areas, but when possible, let's work for it. And then really spread your knowledge as you learn, like pull the next set of parents up with you. So if you see a kid who you have concerns about, or parents have concerns and they don't know where to go, like, now you know some of the steps and you've been there. And also just building relationships with other families and with providers, because that opens doors for you, but I think really also cuts through some of that loneliness, or that isolation, or that stress that we can all feel as parents, but we can definitely feel as parents when we have extra challenges that need to be managed. And I think that is my last slide.
All right. Well, thank you so much. Thank you so much, Dr. Sykes. That information, again, is so vital. It is so helpful to our families. And so we do appreciate you sharing that information with our families. And, we just want to make sure that we provide relevant information to our families that are here on this evening. And so thank you. At this time, I am going to introduce our keynote speaker for tonight, who is Dr. Dan Curry. Dr. Curry is the professor of pediatrics and psychiatry at the College of Medicine at the Ohio State University, and in the section of developmental and behavior pediatrics for Nationwide Children's Hospital in Columbus. And so he's going to be discussing some early intervention for autism spectrum disorder, and will provide information for educational interventions, federally mandated programs, and varying services that are available for additional support. So Dr. Curry, I will let you take it from here.
Thanks very much, Janet. And if we could go on to the next slide, please. So when we talk about interventions in general, the goal of interventions for individuals on the autism spectrum are to minimize any impairments that their spectrum is causing for them. We want to maximize their functioning and their quality of life, and we want to optimize medical care that they receive. And then perhaps most importantly is to do all of this in this framing and setting of supporting the child and the family. Next slide, please. So let's talk a little bit about some of these interventions. You had a real nice description of this from Judith City earlier, talking about the legislation surrounding all of this, and the tax dollars that we all pay go into supporting public educational interventions. Educational interventions, as we heard earlier, there are federally mandated programs. These include the early intervention programs that are in every county, in every state in the United States for children from birth to age 3. At age 3, the responsibility for providing these programs switches over to the education system in each state. And so the public school system then takes responsibility and the services change in terms of where you would be receiving those. The services that are provided include speech and language services, occupational therapy for teaching motor skills, and then physical therapy for helping with problems such as muscle weaknesses or other difficulties like that. These services might be provided in a resource room in a school, or they might require an autism-specific classroom, depending on how severe these services need to be, how comprehensive they need to be to meet your child's needs. While I'm talking about these educational interventions, an educational intervention would also include a behavior plan if necessary. A behavior plan may be needed to make sure that your child's behavior isn't interfering with your child's ability to receive these services. So for example, a child who's having a lot of behavioral outbursts and the school is calling and saying, you need to come pick up your child. We can't have him doing this in our classroom. That setting, school needs to provide a behavior plan also, because your child isn't going to receive any services if they keep sending them home. That is different from some of the other behavioral interventions that you were hearing earlier, such as applied behavior analysis or ABA, which are actually a behavioral intervention. So there's a slight difference there. Next slide, please. Now, the interventions on the previous slide, those are all covered by your tax dollar. Those are provided free of charge to families whose children qualify by virtue of their autism spectrum disorder and the difficulties that they're having reaching appropriate developmental milestones with that. Separate from that, there are private therapies that you may be able to access. Again, many of them the same sorts of therapies: speech and language therapy, occupational therapy, physical therapy. But we may also get into such things as social skills groups to work on those difficulties with social interactions that are a common core part of autism spectrum disorders. Therapeutic recreation may also be covered by through private therapies, may be covered by your insurance, or you may have to pay out of pocket. And then behavior management. And here we are starting to get into providing behavioral interventions through your insurance coverage, separate from what your child is getting in school. Your child may receive these therapies both through these private sources in the community, and your child may receive other sources through the school. And generally, what we do encourage families is to access all of the resources that you can. The better we are able to provide interventions, the better outcomes are going to be. So as you heard Dr. Sykes mentioning earlier, advocate for your child, advocate for the services that they are due under the law. Next slide, please. Now, as we get a little more specific, some specific strategies, they fall in a couple of different categories, and one is comprehensive treatment models. Comprehensive treatment models are looking at all of the difficulties that a child is encountering. So they'll be looking at speech and occupational therapy and physical therapy and perhaps sensory issues and behavioral issues. They're not looking at just one of these, but a very comprehensive approach to a child's developmental difficulties. So these go by different names in different places: early intensive behavioral intervention, or EIBI, you may have heard of, applied behavior analysis, or ABA, the TEACH method, the Early Start Denver model, and the developmental individual differences and relationship-based model, also known as floor time. These are all comprehensive treatment models. Several of them, such as the Early Start Denver model and the TEACH method, are manualized so that they are delivered in the same way in different settings across the country. One of the problems is not all of these models are available in every city across the country. So what interventions are available in your community may vary from what are available in another state or in another town just a few miles away. Next slide. Then there are more focused intervention models. Again, you see applied behavior analysis here. So applied behavior analysis, when it's used as a focused intervention, may be targeting a specific problem behavior. For example, a child who is persistently pulling at their ears. With applied behavior analysis, the therapist will be working on techniques to distract the child from pulling on the ear, to reinforce doing something other than pulling at their ears. And that would be very focused on pulling at their ears because that's a problem behavior. When ABA is done as a comprehensive model, that same behavioral therapist is working to encourage speaking and communicating, to encourage appropriate use of a spoon and fork for self-feeding and a variety of other self-care skills. So the same behavioral technique is used, but to teach a variety of skills, not simply to correct a specific problem behavior. Other focused intervention would include things such as, please go back, as sensory integration for children who have a lot of sensory difficulties, very sensitive to specific sounds, smells, lights, and so forth. And then parent management training. And I am a big fan of parent management training because as a parent, you are there when the behavioral therapist isn't. You are able to provide appropriate management of your child, provide appropriate teaching in a behaviorally oriented manner when the therapist isn't there. So the more that parents are able to carry out behavior management training, the more you're able to teach your child and to promote appropriate behaviors when you are not receiving other services. Across the Autism Treatment Network that is supported by Autism Speaks, we really emphasize parents learning these behavior management skills because they do a lot for improving their outcomes of their children. Next slide. Medical management is another intervention, and I am a pediatrician, and prescribing medications is probably what I do best. But that doesn't mean it's the best thing for every child. First thing we need to do is to look at any medical conditions that the child may have. What we have learned is that children on the autism spectrum have more sleep problems, more nutrition problems, more GI problems than typically developing children. And so we really focus on identifying those and seeing that those are managed appropriately. We also know that neurologic problems occur more frequently, especially epilepsy. And then all of this, along with the core symptoms of autism, problems with social communication and interaction, can lead to behavior problems. When we have all of those other interventions in place, when everything is being done to help this child overcome their symptoms, and it isn't enough, we may need to consider medication. But first, we need to make sure that we're dealing with these medical conditions appropriately. Just this past week at my institution, we had a young adolescent who was admitted with problems with behavioral regression and aggressive behavior. And on evaluation, it turned out that the young man was very constipated. Once we cleared up his constipation, His behavior returned to normal. His aggressive behavior stopped. So I can't emphasize enough, pay attention to your child's physical health, get them appropriate medical care. Often if we do that, we find that all of our other interventions are more successful. Next slide. If we have problems where we need to look at medication for behavior, we want to consider other causes for it. As I just mentioned, the possibility that some other physical health problem might be causing this behavior. We want to maximize the supports that we have available for the child. And then if we are going to start medications, we want to identify the target behavior. What do we want the medicine to help with? Okay, we don't take a medication for one purpose expecting something else to get better. So be very clear about what our goal is for medication. When we start medications, we encourage physicians and families to start with a low dose and to adjust it slowly. Don't be too quick to increase it, because even at a low dose, after a few days, the child starts adjusting, may be able to learn better and respond better, and we may see continued improvement even on that same low dose. So start low and go slow. We also use data to determine the efficacy. It's not just, well, I think he's doing better. If he was having 12 outbursts a day and we're down to 3 outbursts a day, that's clearly better. So we do encourage families to track this before we start medicine. Once we've identified what the target behavior is and our goal is, we like to collect some baseline data and then track it as we start treating to see if we're really getting better or not. Next slide. So some of the interventions we might have with medications for children who are very hyperactive and inattentive, we have stimulant medications. You've probably heard of some of these, such as Concerta or Adderall or Ritalin. For children with a lot of problems with irritability and outbursts and self-injurious behaviors, antipsychotic medications have been shown to be effective. For those who have anxiety and mood problems, we may use the selective serotonin inhibitors. These are medicines that you've heard of, such as Prozac or Zoloft. And for sleep problems, we often will recommend a medication called melatonin. Next slide. Here we go. So finally, the interventions that are available to you, as I said, they're delivered by different service sectors. Some of these may be only available through private services in your community. Your insurance may not cover them. Your community may not have some of these interventions, so these can be difficult. We want to communicate with your provider. Autism Speaks, as you've been seeing in the chat box, has a variety of resources to help you navigate this system and identify services that might be near you or appropriate for you. And then coordinating services is an important part of this so that you can get all the services that your child needs and get them in a timely fashion, as well coordinated as possible so that we avoid overlap, but make sure that everything is covered. Next slide. Some people ask about other treatments such as complementary and alternative medicines. These are not the mainstream medicines, but often families hear about them online or through other resources. A lot of physicians don't discuss this. We encourage physicians to ask about it and for families to share with the physicians what they're trying. One of the things that we're concerned about with these treatments, the reason they are alternative is often because there isn't a lot of evidence that they really work. They often have fairly broad claims that they will cure a problem. They often don't talk about potential side effects. They can be very expensive, and certainly conventional treatments can be expensive, but conventional treatments are usually based on good evidence that they work. A lot of alternative treatments are based on a few case reports or a lack of evidence. So we urge caution in you looking at these and discussing these with your physician. And I think that's my last slide. There we go.
Yeah.
So I'll turn that back over to you, Janet.
All right. Well, thank you so much, Dr. Curry. And I know in my need for trying to hurry up and get through this presentation to give you as much time as you needed, I failed to mention that, you know, Dr. Curry, he is also, his current primary focus in his role is medical director for the Autism Speaks Autism Learning Health Network, you know, where they develop best practices for the diagnosis and treatment of autism spectrum disorders. So his knowledge, his expertise is so important to the autism community, and we thank you. Thanks to all of our speakers for sharing their time and their expertise. Thanks to our amazing team as well. And we also want to thank each and every one of our attendees for tonight's session. And we hope that you will join us in 2 weeks for January 27th, which is our last and final session. Now, at this time, I am going to turn it over to Marianne to see if we have time for a few questions, and she will take it from here. Thank you, Marianne.
Thank you. Before we get into the questions, I just want to recognize the Autism Response Team. This is one of the resources that is available to families, other family members, grandparents, whoever feels like they need to talk to someone who can give them advice or suggestions on what they might consider in terms of services, or in terms of, we get lots of calls from families who feel uncomfortable about approaching another family member about autism. And we have resources for you. We have a family support toolkit that covers grandparents and neighbors, and just it's a good resource because it helps you to figure out, well, this is the way that I want to tell my neighbors, or this is the way I want to let the rest of my family know. So, you know, the Autism Response Team will work with you individually about your child or loved one, and support you through that. So you can contact them at that 888 number, or in Spanish, 888-772-9050. And then, of course, email help@Autism Speaks. So keep them in mind. They're a dedicated team. So let's look. Colleen. I'm going to call upon Colleen in terms of the questions that we might, here we go.
There's some questions that are really specific that might be better suited for the Autism Response Team.
Do you want to go ahead with that, Colleen, and let us know what they are?
Well, my first one, I think that would be more general, is do individuals with autism qualify for Medicaid?
So that's a Judith question.
So I will give you the answer that everyone loves to hear. It depends. So definitely once someone reaches the age of 18 and they become registered with SSI for Social Security, that also qualifies them for Medicaid. There are other ways to access Medicaid if you have autism, and it depends on how your state does it. So there are different ways to access it. So what I would recommend is that you contact our Autism Response Team. They can ask you about what state you're in and then talk to you about how you might be able to access Medicaid. In some states, you can access it because you have an autism diagnosis. In other states, it's dependent on your income, so it varies state to state.
That's great. And I think another one that a lot of people would benefit from is, do you recommend getting a second opinion? And what is the difference between educational and medical evaluations?
Who would you like to answer that question? I'm happy to talk about educational and medical evaluations, but Dr. Curry also might have something even more exciting and profound to say.
Well, I don't know that it's exciting or profound. I think that any time that a family has concerns about the diagnosis that their child has and questions it, absolutely you should get a second opinion. So I do encourage that you get that. The difference between an educational and a medical evaluation, this gets a little profound. There are over 100 different types of psychology classifications. And just as I'm a pediatrician and I don't perform neurosurgery, the Code of Ethics for Psychologists doesn't allow psychologists with some kind of training to make diagnoses that other psychologists can. And for example, some school psychologists, it's not within their certification set to allow them to make the diagnosis, but they recognize it. And Jennifer's going to say something, and then they will dance around it, and they know that the child has it, but they can't say it, and so then they will encourage another evaluation. What did you want to say, Jennifer? Dr.
I
Sykes?
think you might be referencing, that's true. There are definitely different ways that psychologists are classified and labeled, but there's also the educational classification. So when your child goes for an IEP evaluation, autism is an option, but that's an educational classification. That's not a medical diagnosis. So that's really only in the school system. What services are we going to offer them in the school system? If you try to take that to an ABA provider, and the ABA provider only sees people with autism diagnoses, they're not going to recognize that because it's not a medical diagnosis. So for that medical diagnosis, you need a psychologist, a neurologist, a pediatrician, someone outside of the school system to evaluate your child and diagnose them. And that's the most common distinction that people are hearing about. And so depending on who you go to, if you go to a school psychologist, they're going to tell you, I can't really label this, but they can label it in the school setting. If symptoms consistent with autism is what's impacting your kid's education because your kid is aloof or engaging in repetitive behaviors or doing things like that, that's how they can classify them.
And can I throw one more nuance in there too?
Sure.
It's also important to note, as we were talking about, you get the medical diagnosis, and then there's also educational criteria in IDEA, that federal law that I talked about before, that kind of defines what autism spectrum disorder is for educational purposes. Keep in mind that sometimes the members of your IEP team at your school might try to avoid giving an autism diagnosis, not because of scope of practice or anything like that, but more because they're worried about the benefits or the educational services they'll be required to provide that are specific to autism. Some states have what they call an autism supplement that kind of gives you even more IEP services if you have an autism diagnosis. So keep in mind, they might be trying to avoid it to reduce costs, not to be a cynic, but I have seen it happen. So if your child is diagnosed with autism spectrum disorder and your IEP team is saying, oh, no, we don't think this child has autism, that happened to me personally, then you'll want to get an independent evaluation and work with your IEP team on that so that they can be properly classified and get what they're entitled to.
Judith, I also would like to confirm the answer to this. So if you're seeking services through your insurance company, you need a medical diagnosis? Yes. Okay.
Yeah, so the insurance laws that I referenced earlier, you have to have an autism diagnosis, and then the treatments are prescribed by a licensed physician or licensed psychologist as medically necessary.
Right.
So there's some gobbledygook terminology for you, but it's important. One more thing I'll say quickly is I would recommend, not from a legal perspective, but just a practical perspective, that you not give your IEP to your health insurance or vice versa. Like, keep those things separate because they try to exploit and confuse what services look like. Just keep them separate. They're two different things, both very important.
Very good. Okay, well, we're at 4 o'clock.
Or 6 or 7 or 5, depending on where you are.
Oh, sorry.
Your hands on the West Coast.
I thought everybody was in California. Well, go ahead. Janet, do you want to finish up, wrap us up? I think, the questions that we do have your email attached to them, so we're able to send them over to the autism response team. If for some reason you don't want us to, just let me know.
And that's what I was going to share, that we will make sure the autism response team get all questions that were not answered. And thank you all so much for joining us on this evening. And again, please join us on January 27th at the same time for our final part 3 session of navigating a new autism diagnosis. Thank you all for joining us, and you have such a great evening.